Welcome back, viewers. Thank you so much for tuning in today to this channel. If you are new to the channel, please kindly subscribe. Find it in your heart to subscribe and hit that notification bell so that when I post another video on this platform, you'll be the first person to be notified, and you'll be able to, obviously view it and also share it. So on this channel, I do post anything to do with social work. I've been a social worker for the past 19 years. I've been practicing in many different countries besides England. And some of the information I do share here is out of my own experiences as well as from people closer to me, whom I can call fellow colleagues in the profession. So one or two people may be able to learn a few things from these videos that I post on this channel. Thank you so much for tuning in. So in today's topic, I'm just gonna talk to you about some of the most common challenges faced by social workers practicing, especially with children. Some of these things may also be applicable to social workers practicing with adults, but I'm going to be focusing more on social workers who are working with children because that's what I've been doing for the past few years. So I think some of the information would be more applicable to that, but it doesn't necessarily mean that it's not going to be applicable to other social workers working, with other parts of, service users, something like that. Yeah, so this list is not going to be exhaustive. Like I said, the topic is saying some of the most common challenges. So it's not going to be an exhaustive list. If you find out if there's something that I would have, left out, on this list, it's not it's not done deliberately. But I just picked the most common challenges faced by social workers, right? Without wasting much time, let me jump straight into it. The first and foremost challenge that's faced by social workers practicing with children and families is high caseloads. This is across the board in most teams that social workers might work in. You might find that you've got social workers working with children in care, you've got social workers working in referral and assessment service, you've got social workers working in the safeguarding team, you've got social workers working in the fostering team or in the adoption team. High caseloads is usually across the board. That's one of the most, pertinent challenges faced by social workers working with children and families. So when it comes to high caseloads, what I'm trying to say here is, we do often manage a large number of cases on a daily basis. So even if you close cases, you will always get allocated new cases. So it's always a revolving door in terms of cases being allocated to you as a social worker on the front line. So usually, most local authorities, I would say, really, there is, an issue of high caseloads, that social workers have to actually manage and deal with on a daily basis. You can imagine what that does to your own emotional well-being, what that does to your own mental health, and what that does to your own capacity to actually remember stuff and be able to offer the best, support or service that you can, offer. So if you're a service user, please bear with the social workers. It doesn't necessarily mean if your child or if your two children are open to that particular social worker, they're only dealing with your children or that one particular child. It means possibly, for example, they might be having 40 other children to deal with, or they might be having 15 other families to deal with, really. So you need to be patient, understanding that, I'm not the only one who is open to this particular social worker. Thank you so much for that. Obviously, we know that, higher caseloads lead to higher stress levels. So those are some of the things that social workers have to contend with as well when it comes to working with children and families, right? Point number two, some of these cases are increasingly complex cases. So social workers are dealing with increasingly complex cases. What do I mean by complex cases? You might be having the toxic trio in the cases that they're dealing with. That's domestic violence, mental health, as well as substance misuse. Or sometimes there could be an issue of parent, child to parent, violence going on there. As you know, some of the children may have double diagnosis, say ADHD, ASD, and sometimes the support services which are supposed to be supporting those children may not necessarily be in place, or the parents don't have a clue of what support they actually need at that particular given time. We also have increasing incidents where children are kind of relying more on gadgets because parents can't be bothered to actually parent children or something like that. that may not necessarily be the case, but we are increasingly living in an environment where children are relying more on gadgets. And in as much as parents try to put in some boundaries, some rules, parents do struggle. So we are increasingly dealing with more complex cases. What that does is it takes away precious time that social workers could have actually done, quality work with children in terms of eliciting their views, wishes, and feelings. It also takes away time for some of the more demanding cases. The other complicating factor also, which leads to the more complex cases that we're dealing with, is we are having an aging population. So obviously, for example, those social workers dealing with adults, because of the aging population, it comes with its own challenges as well. The cost of living is high, so we are increasingly getting cases where it might be a bit difficult for social workers to distinguish whether this is poverty or whether this is neglect. Because of the high cost of living, parents do struggle to put food on the table for the children and all that. So those are some of the things which are also going on there. It's also important to point out that obviously a few years ago, we know that there was the COVID-19 pandemic, which brought up some other challenging issues as well. For example, if a parent is having long COVID, they may have symptoms which are persistent and which might actually hinder them to be able to do what they're supposed to be doing. So we are increasingly dealing with more complex, more challenging, cases, which is also impacting on the social workers' ability to actually manage, and also their ability to actually effectively work on these cases in as much as they would have want. At the end of the day, they are thinly stretched on the ground when it comes to supporting families that they need to be supporting. The third most common challenge that social workers face is the emotional stress that's associated with the job that we do. I always say in my previous videos, if you have watched all my videos, social work is not for the faint-hearted, especially when you're practicing with children and families. It's not for the faint-hearted. It's not for people who are not willing to give 100% or who are not willing to go the extra mile to actually make sure that families or children that you're working with are comfortable. So that comes with its own emotional stressors as well, to an extent that, because obviously the nature of the work that we do, I would admit it's emotionally taxing. There is also what we call vicarious trauma, which happens for people who are in helping professions. You can go and Google what vicarious trauma is, but it's a profession which is associated with emotionally, stressing levels, even of anxiety and stuff like that. So that's point number 3. Point number 4, all these things that we're talking about, you can imagine if you're doing them on a daily basis, knowing that you are only entitled to 30 days of annual leave per each calendar year. That is if you are employed as a permanent worker, or you don't have any annual leave. If you're employed as an agent's worker, you can only work out your own annual leave, which you're not going to be getting paid for. Some social workers actually do suffer from burnout as well. Remember, I mentioned about being a profession which is emotionally taxing. So the intensity of the job that we do, the demands of the job that we do, the high expectations in terms of the work that we do also leads to burnout. Some social workers even leave the profession because of the emotional stress that they've gone through. Sometimes some even suffer physical injuries when it comes to sciatica, pain in the legs or pain in the shoulders, whatever it is, which might end up being permanent. And some people even do develop some conditions which are chronic or which are persistent due to the burnout which they do suffer in the profession. So point number 5, bureaucracy. This is quite prevalent because obviously most social workers are employed within local authorities. You know how it is when it comes to how local authorities do work. The wheels of the local authorities may be grinding quite slowly in terms of getting things done and all that. So in terms of this is versus you working with families who actually need, and sometimes we're also looking to see if you can get a small budget approved for a few specific things that you'd want to get for that particular family. But sometimes the bureaucracy within the organizations that we work with can be a hindrance to good quality work that can be done by social workers. So that's also something to actually take into account as well. So it's really difficult for social workers to navigate that bureaucratic maze. I would say bureaucratic maze, using the word MAZE. which, sometimes can hinder their ability to actually provide, care effectively. So that's also quite important for us to point out at this point. Then point number 6, it's actually resource limitations, which is really, really crucial and something for me to mention at this point. Resource limitations. As you know, there have been budget cuts for, I don't know, since I joined most local authorities that I've worked in. There's always budget cuts going on, not only on the local authority level, but also on the national government level. So you'll find that these resource constraints may mean that there are limitations as to what social workers can effectively do in terms of supporting the families that they're supporting. And sometimes the support which they would want to actually put in place doesn't match their expectations, or doesn't match the expectations of the service users that they are supporting. So that's something that is important for me to mention at this point, because obviously it impacts on the quality of care that social workers can actually provide to service users. So resource limitations, that's point number 6. Then moving on, let me talk about the challenge of recruitment and retention. This is really, really, really important, because I put a video, for those who watch my channel quite a lot, there's a video which is there on recruitment and retention, where I tried to articulate the challenges that local authorities do face when it comes to recruiting and retaining social workers. As you know, things have been going up since, I would say, around 2008, thereabouts, but salaries that people are getting are not really matching the inflation, or that they're not matching the prices in which things are being sold in the shops or stuff like that. So social workers are not immune to that. They're also impacted by that. So in terms of local authorities paying something which is commensurate with the work that social workers are doing, that's a challenge, really. So you'll find that most local authorities are also struggling in terms of recruiting and retention. So what that does, you may wonder what would be the impact of that. Obviously, if you have got social workers who are not paid well, they may not necessarily produce or outcomes, or actually necessarily work to the level that you would expect. That's one. Or the second one is also, if there is a high staff turnover in a particular team or in a particular local authority, then it means the ones who are left are going to be absorbing the pressure or the amount of work which would have been left by those that would have left that local authority, or those that would have left that particular team. So that's how it impacts a social worker at the at the front line. But also in terms of recruitment and retention, it means the local authority might be paying more in terms of training and rolling out training to new staff who may not necessarily stay as well, or who may end up leaving. And the impact it has on the families that we're working with, it means there is so much changes in social workers to the service users and the children that we are supporting. So that's one of the challenges. It might be a long shot in terms of trying to circumvent that or trying to deal with that issue, but that's one of the most common challenges which is faced by social workers when they are practicing on the front line. Obviously, I mentioned about the pressure that it puts on the existing staff if people do leave. If local authorities fail to retain, or teams fail to retain staff, it puts pressure on the few staff members who are left, because, for example, if somebody is leaving and they had 40 children that they were dealing with, somebody has to take over that caseload. Or if there's no somebody who's going to take over the whole caseload, it means it has to be redistributed to all the social workers in that particular team or in that particular service. And you can imagine the pressure it puts on those particular individuals. So these are things that social workers deal with almost on a daily basis. And then point number 8, which is also important, which has been highlighted quite recently, is with regards to the public perception of what social workers do, public perception of who social workers are, which may not necessarily be the most positive perception out there. People view social workers as baby snatchers. That's not the case. We don't have the power to remove the child from your care. the courts are the only people with the power to remove the children from your care, or if the police protect your children, then they've got the power to remove those children for the first 72 hours whilst measures are being put in place to bring that case either before the courts or before, a child protection conference to discuss what's going to be happening next. Right, so public perception is something that social workers deal with almost on a daily basis, and I know most social workers wouldn't want to work in the same area where they live because of some of the challenges are also associated with the work that we do. There are also risks which are associated with the work that we do. That's one thing as well. So we sometimes, when it comes to public perception, if you look at some of the cases which make it to the news headlines, they are not necessarily the most positive news articles that one can read when it comes to work that social workers do. It's rare that you find social workers being praised for the good work that they are doing, but as one of the managers working in social care, I know very well the brilliant work that men and women do out there each and every day and each and every even weekend. Remember, social workers, there is social workers always working 24 hours. There are those who work in the night whilst you are sleeping. There are those who work during the weekend whilst you are resting in your house. There are those who work during the week whilst you are at work and so forth. So we need to start to appreciate the work that social workers are actually doing out there. So public perception, so sometimes we work in a blame culture as well. As I mentioned earlier on, most of the cases that make it to the public arena or to the news articles are kind of negative. That feeds into the culture of blame, which is already in the air when it comes to the work that social workers do. Issues to do with austerity doesn't also help social workers when it comes to the work that they do. There is also the fact that the role of the social worker is quite misunderstood, in as much as there is quite information there online which explains what social workers do, the powers that they have and the powers that they don't have. That role is misunderstood almost on a daily basis. So that's one thing also which I need to be mentioning here. And it's also important to mention that our role is undervalued by the media. And when it comes to the way it is portrayed, even in film or in drama, it's not always positive, really. So that's also one thing that we kind of tend to contend with as social workers. Right. So I think with all these challenges which I've mentioned, I think the most important thing is to highlight that there is need for a strong systems to be in place to support social workers, not necessarily with their recruitment and retention and pay and salaries and all that, but also ensuring that they've got enough professional development, ensuring that the culture within the media is quite positive towards the work that we do, just like it is positive towards other professions like teachers, like nurses, like doctors, or like journalists, or like lawyers and so forth. I think it's high time that the media needs to start treating us in a positive light. And I think the work that I'm doing also is a YouTuber when it comes to the social work profession might also to an extent help put social work in a positive light. Yes, like I said, I really appreciate what each and every men and women out there who are qualified social workers, the work that they are doing, not only qualified social workers, but also other ancillary support staff, including family support workers and business support, officers who are working alongside social workers. I really commend the job that you are doing. Please keep it up. And with those few nuggets, I think somebody would have grabbed one or two things. Thank you so much for tuning into the channel. If you haven't subscribed, please do subscribe and hit that notification bell so that when I post, you'll be the first person to know. Thank you so much.